We're good, man.
What's going on?
Oh, good morning.
Morning, morning.
Early on a Sunday. You normally wake up this early?
I do. Thanks for making an exception for me.
Happens, man. No problem, no problem. All right. So tell me tell me a little bit about the issue that you're dealing with right now.
Yeah, so I wouldn't say it's anything debilitating. Like I get through my day to day perfectly fine for the most part. It's just that it's one of those things that's been on and off for a very, very long time. And um just kind of tried like I guess the standard PT stuff just throughout the years, but kind of never really fully went away. And I know you kind of take a different approach. Hearing the story of you helping your mom out with kind of this alternative method, or so to speak. Um, and I saw a lot of your like workshops and stuff, but just wanted to just talk to you about it and see behind the scenes, I guess, or just see what it's about. It kind
The
of
the
it
what
happened. Sorry, go
sorry,
ahead.
the what stuff?
Because you know how you take kind of a different approach, like the alternate pathways and stuff like that, versus
Oh,
like,
okay.
yeah, just wanted to kind of see like how that would help out, I guess, so to speak.
Mm-hmm. All right. Gotcha.
Yeah. So in terms of the left low back, I'd say if I could think of like a specific incident, probably deadlifting back in college. Pulling up, I felt something. And then ever since then, just never really felt 100% over the years.
Mm-hmm.
Um, And usually, like the most aggravating things where I do feel it, deep into a squat, deadlifting, and then running. Sometimes I feel it when I land on the left foot. So that's kind of where the back has been. And then in terms of the hip, it started right before the pandemic. I started doing Muay Thai, and I didn't know proper form at the time. So when I was kicking with my right leg, my left foot stayed planted. So I was just cranking into internal rotation over and over and over again without letting my foot go through. And I think that's when it first started. But ever since then, just kind of deep achiness that um, kind of comes and goes, mobility wise and strength wise, doesn't feel the same as the right side.
Mm-hmm.
Um, I'd say that's the main thing for the hip.
Okay.
Yeah.
So so David, you're a physical therapist,
Mhm.
right? What kind of, I guess, philosophy or techniques or have you tried to use for yourself?
So in terms of the back, definitely more sensitive to extension based stuff, like deep into extension. I kind of feel something off on that left side. So just kind of the typical, just like deep abdominal strengthening. Just trying to get my body more used to just the different ranges of motion, just getting more into like flexion. So a lot of like what's it called? Like supine work, trying to get that going.
Mhm.
Um, for the hip, a lot of mobility difference between the left and the right. So did a lot of like banded moves, just hip strengthening related stuff. I don't know how you are, but at least between like my PT friends and I, like we're the worst patients to ourselves, like after
Oh,
we
yeah.
take care of everybody else. So
Same.
it's hard to say because if I'm being honest, I probably haven't stuck with like a consistent thing, enough to really see the progress. But honestly, just kind of the stuff they teach you in school.
Okay.
Yeah.
Have you done, have you learned any Mackenzie?
Oh, like repeated extension, repeated movements. Yeah. Haven't tried that too much.
Okay. Yeah. And how long ago has it been since college?
Um, like 7, 8 years.
Okay.
So it's been a little bit.
Got it. Got it.
Yeah.
What is the biggest thing that's annoying you right now with this issue? Enough that we're on the call today.
Um, I think part of it is just how long it's been going on
Okay.
and how it's just not. going away. I guess part of it too is kind of a crappy feeling being a physical therapist myself and not being able to take care of it on my
Mhm.
own. Um, I guess wanting to squat, deadlift, and run without that last like little niggle of like, I don't know if like I don't know how it's gonna react or how it's gonna respond.
Okay, tell me
Mhm.
about how you currently doing your squat, deadlift, and run. As in, like, are you just not pushing the weights? Like, what is like, where do you want to be and where you are now? I think I just want to understand where that gap is.
Oh, got it, got it. For now, in terms of lifting, I don't know how close you were with Jared when you were part of Honey Badger, but I
We
worked with
haven't
him.
talked too much.
Okay, but I was under his coaching program for a while, so I was doing more heavier base powerlifting stuff.
Hmm.
We would have to do a lot of modifications of like limiting range of motion through like box squats and whatnot. And then once we started getting heavier, like the hip definitely would just get irritated where I wasn't able to push as much. Um, so right now, running is my main thing. So my strength training doesn't go too heavy. It just kind of complements it. Um, One thing I put on the intake was like I have been kind of having some left shin related stuff. Don't know if it's kind of that whole chain thing you talk about where either from the foot or in the hip something's not working as ideally. Could be coincidental that it happens to be on the left side, but I think that might be related too.
Okay, tell me about the running. Like, why running? How long are you running? What's going on? Like, at what time?
Um, Started running January of last year. Did my first full marathon after about 10 months of training. For the most part, I was able to do it without any major injuries.
Mhm.
And then right now, averaging and usually like between like 15 to 20 miles a week. And I'd say it's like a 2 or a 3 out of 10 discomfort, like pretty manageable. And I've just been doing some stuff to work on like foot intrinsics, hip strengthening. So not 100%, but like able to get my runs in.
Mhm. 2 to 3
Mhm.
out of 10 pain, like
In
w-
the shin.
in the shin. Okay, in the
Yeah,
shin.
in the shin. But I have found like when I work on just core strength, hip strength, and then the foot intrinsics, it definitely helps a little bit.
Okay, 2 to 3 out of 10 in the shin. Does it bother your back and left side of the hip while you run?
Um, I feel it. It's not painful where I'm like, okay, I should probably slow down or stop. But it's just one of those like it just doesn't feel 100% like the
Mhm.
right side does, if that makes sense.
Yep, that makes sense.
Hmm.
And when you're doing other exercises like lunges and single leg unilateral stuff, are you
Hmm.
feeling a difference between the right and the left?
Yeah, 100%.
Tell me about that.
Less stability on the left, and then just from like a strength standpoint, it feels weaker. Like I've tried the controlled articular rotations on the left side, and I don't know, it's just a pain is too strong of a word, but you can just tell something it just isn't working and feeling right in that area.
Yeah. Describe that for me. Let's say, for example, you're doing like a lunge with the left leg in front. You know,
Hmm.
how would that feel compared to the right?
More strenuous, just from a stability, strength standpoint. It takes more mental effort just to make sure like I guess form wise is good. And then usually like deep into hip flexion is where I typically feel it, kind of that pinching, like deep laterally type stuff. So those are probably the main differences. Whereas the right, I don't really have that.
Yeah. What's your biggest concern surrounding this issue?
Uh, just the chronic nature of it, just wanting to just kind of bite it in the butt.
Yeah. Got it. Honesty of it. Um, Almost unrelated question. Are you in the clinic? Are you leaning really into the online platform? Like where is your business going right now?
Oh, like me personally working wise.
Yeah, yeah.
So I have 2 to 3 that I'm going online with. And then right now my main thing is home health.
Okay. So you're
Uh-huh.
driving, traveling.
Yes.
Okay. How long are you in the car usually? On average?
Um, Probably, well, between patient and patient, anywhere between 15 to 30 minutes. I treat for an hour, and then to and from work is probably anywhere between like 30 to 60 minutes.
Hmm.
So maybe 3 to 4 hours out of the day, give or take.
Okay, got it.
Yeah.
Nice. And you doing orthopedics or are you doing like acute or subacute?
Kind of a mix of both. So I
Okay.
guess orthopedic wise, it's a lot more like joint replacements. And every now and then you'll just get kind of your standard back pain and things like that. But a lot of it is also just strength balance, fall prevention, um, stuff like that.
Okay. And let's say we take care of this left back, left shin, left hip issue. Like, what would you do differently? Like, would you squat more? Would you like, would you add more volume to your runs and stuff? Like, what would change if this is all better?
Yeah, probably. I think just peace of mind is the biggest thing, honestly. Um, in terms of training, maybe I just feel more comfortable pushing the volume a little bit more.
Okay.
Um,
What do you mean by peace of mind? Because I mean, it sounds like you're doing everything. Like, you can do Muay Thai, you could do like all these things with like
mhm.
a relatively low level of pain. So, what do you mean by peace of mind?
It's like that like annoying girlfriend or friend that just doesn't go away. It's like
Okay.
I just want it to be gone. Like
Okay.
even now, like just sitting and talking to you, like super, super minor, but it's just like I can tell something's not 100% with my left hip and into the back.
Got it.
Yeah.
My God. How often are you thinking about this? Like just the left side back and hip.
Um, Definitely when I'm working out, and then sometimes it's just like when I notice the random niggles. I'd
Hmm.
say I'd say decently.
Okay.
I never really put a number on it, but um, like out of the other physical stuff I've had, it's definitely the one that's been going around for the longest and hasn't really gone away.
Okay. So it's occupying some good amount of mental energy in your head.
I'd say so. I'd say so. Like it's to the point where like when I'm driving to and from like patients' homes, like in the car, like I just like press my knee out into the door to work on like hip abduction and stuff like that.
Oh wow. Okay. Got it. Right. Sounds like I have what I need. Give me a second here. Okay. So it sounds like we're dealing with a on and off left low back and left low back slash left hip. And the left
Mhm,
low back really starting to happen around the college time when you were deadlifting 78 years ago, coming up from a deadlift. And it seems like things haven't been the same ever that incident. Things are aggravated currently, going deep into a squat, deadlifting heavier, running and landing on the left foot. You can start to feel some discomfort there, correct?
mhm,
Okay. Left hip, that more started doing Muay Thai and you found yourself just not pivoting your left foot. So maybe that be causing a lot of internal rotation issues into the hip. That's
mhm.
the conjecture here. Back is sensitive to extension on the left side. Doing some supine work, hip mobility, and hip strengthening stuff helps, but it isn't really touching the root cause of issues where things are relieved for good. Okay. And you want to squat, you want to deadlift, and you want to run more. Was doing some heavy based powerlifting with Jared and we had to do a bunch of different modifications just so we can get through the strengthening portion of it. But it was up to you. You probably want to just go in there and just get it done and not having to think about the modified stuff.
Yeah.
Right now, running is your main thing, and you started to develop some left shin issues starting in January last year. Did a full marathon after 10 months of training. Congratulations, first of all. That's
Thank
crazy.
you.
And then marathon season here is ramping up quickly too. So
Yeah.
quick element to what's going on. Average, you want to average 15 to 20 miles a week. You have a 2 to 3 out of 10 pain in the shin, and you can still feel the left back and left hip as well. For its exercises, for unilateral stuff like lunges and single leg work, a lot of stability issues on the left side generally just feels weaker. Try some cars, but it seemed to get it, but wasn't quite right. definitely a mental strain just to have this chronic issue that you're dealing with. Because as a physical therapist, you feel like you should have a good handle on this, but yet you're still kind of dealing with it. Um,
Mhm.
Correct me if I'm putting words in your mouth. That might have brought in some feeling of imposter syndrome. That's something I relate to as well at some point.
Yeah, I'd say so. Where it's kind of like I think a lot of us probably go through where it's like if I can't help myself, like who am I to try to help other people?
Absolutely.
Um,
And I think, as a physical therapist, I think we all share that part of ourselves too. Like me, for example, I also have some issues that I'm just not dealing with
mhm.
because first of all, it doesn't bother me as much, but there is that part of me that goes, wow, damn, I should practice what I preach.
Yeah, and I think it's like especially when it's kind of like you and I's where it's like it's not completely debilitating, where it's enough like we can get through the day. We just end up not really prioritizing it.
Hmm. Yeah. No, so I understand that part. I think we sh- share that in common.
Mhm.
But it seems like this is giving you a bit more of a problem only because it's interfering with some activities that you really want to get to doing better
Mhm.
at. Wait a second, I need to just get my mouse back in order. While I'm playing with my mouse to get it back online, I'm gonna have you stand up
Okay.
and get a full screen of you if we can.
Do you need me in shorts or anything, or is our long pants okay?
I think we're okay. If I need to get you in shorts, I think it'd be pretty easy to do, right?
Yeah, just let me know and then I can swap over.
Yeah, I think we
And
should be.
one last thing, I don't know how much of this helps, but like during PT school, what my friends who did like the sports elective, they did like a running analysis on me. And
Mhm,
definitely left side is weaker, where like I drop quite a bit and there's a lot of compression going down through the left
mhm.
side. Is
Yeah,
that okay right there? Well, I mean,
yeah, I think that's pretty good. Yeah. Oh yeah, more light, better.
yeah. Is that good?
Yeah, 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 yeah.
Okay.
So as you're standing here right now,
Hmm.
where is the weight going into your feet?
Uh, more more on the heels actually.
More on the heels on both sides?
Yeah. Yeah.
Okay. No issues from left to right. Okay, got it. Can you turn yourself to your side? Okay. Can you go ahead and reach down to the ground? Okay, and come back up. And how's that feel for you? Anything that pops up?
Just stretching the hamstring, weight still more on the back of my on the heels.
Mm-hmm. Okay. Hands on your hips and arch backwards.
You say here and then go back.
Yep. Back extension. Go far, far, far. Okay, and come
Yeah,
back.
just the left side,
Yep. Gotcha. All right, turn and
left
face
low
me.
back.
Reach the right hand down to your side. Good, and come back up. How's that feel?
More weight on the right foot, and then just not pain, but just not feeling 100% on the left.
Mm-hmm. Reach the left hand down to the side. And how's that feel?
I actually think the weight kind of stays on the right side of my foot, and then just a stretch on my right low back.
Okay. Can you go reach down to one side again?
This way?
Yeah, just go that way. Okay. And then reach down to the other side.
Yeah, so I feel the left low back, not pain, but just it's not feeling right.
Okay. Can you turn yourself to the side and give me a back bend again?
Sorry, my dog.
Come back. Got it. And yeah, and that don't feel good for you.
Like right here, I start. It's not pain again. It just lets me know that something's not right.
Mm-hmm.
Sorry, give me like 1 second. Let me just put the shoe away.
Yeah, yeah, yeah.
Hey, stop. Leave it. Sorry about that.
Rotate all the way to one side. Ooh, how's that feel?
Feels okay.
Rotate to the left side. And how's that feel?
Little like you can feel it in the left hip, just going into the internal rotation.
Yeah.
Yeah.
Okay, stay right there, all the way to the right. And stay, and then go to the left and stay right there. Got it, got it. Nice.
Hmm.
And give me a squat. Give me like two of them. Back up a little bit more.
Okay.
Mhm. Okay. Give me a back view now. And okay, good, nice. Any issues over here?
A little bit deep into the squat, and I think can't trying to remember. I think I tend to shift over to the right side when I squat, if I remember correctly.
Okay. Okay. You balance on your right foot. Back up a little bit because I want to see your feet through the entire way. Okay, good. And give me three little bends without hinging. Just bend your knee.
Oh, like this?
Yeah, exactly. Good. Yeah. Just give me a few of those. Good. Nice. Yeah. Sounds like your dog wants you to take him out to a walk.
Yeah, she keeps. She it's like she knows we're doing something.
Yeah.
Same thing on the left.
Yeah, same thing on the left. Yeah, okay. And come back up. Definitely different for sure.
The stability is very different.
Do the right side again.
I mean, right's not perfect, but it feels a lot better.
Pretty damn good. It's pretty damn
Yeah.
good. All
You want
right.
the left again or?
Do the left again.
Okay.
Yeah, got it. Got it, got it. Can you give me a lunge? Give me a
Yeah,
squat.
just facing you
Yeah, do frontward. Okay. Do it again.
on the right.
Yeah, do it on the right. Okay. Now do the left. And how's it feel right to left?
That one not too bad.
Yep. Not too bad on that one.
Yeah.
All right, let's get started. Now, you see my content, you kind of know, but I'm gonna tell you again. One
Okay,
more time.
cool.
All right. So the approach for you could be a couple different ways we can tackle it. There is a Mackenzie that we could try, which is just repeat extensions. It's simple, it's easy. Might be a nice low hanging fruit if you haven't. Have you tried repeat extensions on yourself?
I mean, maybe a couple times, but it's probably not enough to really see if it's an actual like a pro treatment approach for myself.
Right. So, I
Yeah.
mean, it's a really easy test. We just do 10 of them and then see what
Hmm.
happens. If nothing changed, then we're kind of like, okay, we'll
Yeah.
leave. The next thing we're gonna look at is couple motion from the foot all the way up the entire body.
Hmm.
Familiar with couple motion?
Basically, like pronation of the foot turns into like all that stuff, right?
Exactly, exactly. But we're gonna be a
Yeah.
little nitty gritty about even just the small structures of the foot with the calcaneus and the forefoot and the toes. So we can get
Okay.
good motion over there, then we can get good couple motion up everywhere else. It doesn't seem like you feel very comfortable on your left side of your body,
Uh-uh.
but you don't
Definitely
like
not.
to load that area. So we can get your nervous system to load into that area. I think we might be able to see some good changes in your ability to just move around and just feeling more safe.
Hmm.
So the way I like to think about it is like your nervous system is like a GPS. It's always going to find the most efficient pathway for you to get from point A to point B. You put in an address, if they see a highway, you're going to take that highway every single time. But what happened to you was the highway was closed for a little bit. It was under construction. I think that happened all the way 7, 8 years ago when you
Hmm.
pulled your back. And so what happens when you pull your back? We want to offload that left side usually.
Hmm.
We will plant the foot a little bit differently just to give it some break. So it seems like your GPS had gone through 7 to 8 years in which it never found the highway again, and it just sort of gone on these side streets. So what we like to do today is see if we can get you to experience this highway again and
Hmm.
see if everything just falls back in place.
Cool.
Yeah. Very simplistic view, but of course the only way we can know if it works or not is test and retest. So I took some pictures, showed
Hmm.
some such, and we'll use your pain experience and how comfortable you feel, how smooth these motions feel after doing some of the interventions. Okay.
Okay.
So first one, I would like to do the Mackenzie because it's simple enough that it's like we know within 2 minutes. So
Hmm.
all I want you to do is lie on your stomach. You're gonna press up, and as you get up there, do an exhale at the bottom. So the exhale is just gonna relax your spine. So you get into
Um,
end range extension. Okay,
okay. You want me
and
to just fully straighten the arms out?
uh, if you can, but if you need to take it like steps to get there, do so.
Uh-huh.
Give me a side view.
Side view. Oh. Can you see me?
Yep, yep.
Okay.
And how's that feel when you get up to the top and exhale?
Just a stretch through the stomach.
Okay, good.
Not really feeling too much in the low back.
Okay. 3.
Stretch is getting less intense.
Good.
You said 10, right?
2 more.
Okay.
Good. Nice. Come on up. All right. Now we're gonna turn yourself to the side, other side, and let's go. Give me a back bend. Okay. And how's that feel for you?
I feel like I'm not doing this as much to get the back bend compared to when you first had me do it.
Okay. Discomfort wise.
Um, Maybe like slightly less of that, like not discomfort, but just if not feeling 100%.
Right. So
Yeah.
when the difference is small, I'm gonna count it as no difference. We're looking for
Okay.
big changes. I don't like small data. I love big data. It's like, oh yeah,
Okay.
it's obviously better. So if you can't say that, no change. Let's head back and let's see some side bends.
That
Okay,
one is a little bit less of like that weird, just not feeling 100%.
got it.
Yeah.
Let's go do a rotation, left rotation.
Oh, sorry.
Okay, and how's that feel?
That actually feels better than the first go.
Okay,
I
good.
feel like I have more going to the left than the right now, actually.
Yeah, good.
I don't know how it feels. I don't know how it looks on your end, but
Yeah,
yeah,
it looks more. I have a lot
yeah.
of pictures, and we can take a look.
Okay.
Balance on your left foot and give me 3 little bends. Okay,
Seem more stable. I don't know how it looks on your end.
it's okay. Not
Yeah.
too crazy of a change here. Good. So we know some extensions would probably be a good thing to have in your program
Okay.
for sure. But let's take a look at other things that we might be able to do. And when you're
Hmm.
working out, do you feel like for unilateral stuff, you know how you do in lunges, you're supposed to feel your glute? Do you
Hmm.
feel your glute activating on both sides equally, or does it feel like your left side can't really get that muscle to work?
So I don't know if it's because I'm more focused on it, but sometimes I feel like I feel it more.
Okay.
Like, for example, I was doing squats yesterday, and then when I'm just really focusing on just hip extension at the top and I'm squeezing, I feel the contraction stronger on my left side than I do on the right.
Okay, got it.
Yeah.
On there. Okay, let's do this. Can you roll up your pant legs a bit?
Yeah.
Okay,
Is that good?
I'm gonna have you step back. You don't have to roll it to your knee. That's okay. I just want to see your arches. Good. And I want you to go and turn yourself to the side, so your right arch faces me. So you put your right foot in front.
Like this?
No, no, no. Turn around the other side.
Oh, like this.
There you go. There you go. Perfect. Look
Okay.
straight ahead. And all I want you to do right now is to let your knee bend forward in front of you, and let everything else happen on its own. Okay. Good. Good. All right. Switch side. You turn around and do the left side. Okay. And what do you feel here on the left side versus the right side? Or is they're like they're kind of the same? You can double check again
Yeah.
if you like.
Yeah, I'm gonna just less fluidity, I guess.
Okay. Can you turn your
Not
face?
necessarily painful or anything.
Can you face me and do the same thing? Right foot in front and then a left foot in front. Now left foot. Do the right foot again. Okay. Got it. Got it. Okay. Got it. You see me use a lot of those like anatomy motion foot wedges. Do you have any?
I don't, but if you feel like I could benefit, I'll get some.
Yeah, I think you could, but we gotta put it to the test. Can you get a couple rolled up towels? Because we're gonna make some makeshift wedges. So instead of using wedges, you can
Uh-huh.
be like a little small book, but I like towels, like roll
Towel.
up
Okay.
hand towels.
How many do you need?
Grab like three of them just in case. We'll probably only
Three?
need two, but
Okay.
grab three.
Okay.
Okay, good. Play a video.
Foot pronation
And
drill
this will be your first exercise intervention that we try.
Okay.
with two wedges. The first wedge is going to go under the heel. You don't want to go all the way on top, maybe on the bottom 1/3. Okay. The second wedge
Actually,
is
let
going to
me
go
grab a
on.
different video.
Okay.
Give me a sec.
Corner. Up. No. Wait. Also, I forgot to mention, but for the one where you had me just kind of go forward, I felt the adductor in my left more than the right.
Mm-hmm. Makes sense.
Drill. Our foot needs to be able to access two shapes, and it's a flat shape and an arch shape. And for the flat shape to happen, we need this bone to stay on the ground so it can roll forward and roll down, while this shin bone start to migrate towards the inside portion, towards the big toe joint, and these bones can separate. And then as we bring the shin bone backwards behind the ankle, we need contact on the big toe joint, little toe joint, and heel, and the arch will form. And now we can do this for our body. Take one foot in front here. Stay heavy on the heel as you bring your body weight forward. Let the knee start the motion. This back leg will be straight. It doesn't have to point straight, it should point out slightly. So lock up the knee. And go forward. And come back. And you will notice how, as I go forward, my arch starting to go downward. It starts to flatten out. And I'm looking forward into the horizon. Good. Now this is the forward portion of it. If you look at it from the front, as I bring my knee forward, my knee will actually rotate a little bit inward towards my big toe joint. As I'm doing this, you'll find that my nose, sternum, knee, foot, they all start to line up on top of one another. And you will notice as I bring my weight forward, my rib cage will start to lift up and my pelvis will start to drop down. And this is all happening if those pronation mechanics in the foot is happening. Now, as we come back away, I want you to come all the way back, bring the weight onto the outside edge of the heel, and just slouch through your ribs here. And as you bring all your weight back here, you're gonna feel a nice suctioning of the ground, and you're gonna feel a nice arch forming on your foot here. So we'll put together, we go forward, as tall, and as we come back, foot arches, foot flattens, foot arches, foot flattens,
Feel the left glute working too.
Good.
foot arches. And we're slouching, we'll start from the rib cage here. And if you're finding it hard to keep your heel on the ground or you don't feel your heel, take a wedge. And if you don't have a wedge, some rolled up towel, that can also work. You just want to have something where you can feel your heel. And it just might make this movement a lot easier for you to do.
Okay. Let's have you step away and so I
Are
can
you
see.
trying to fix the position of your lower leg and foot? Are you,
Sorry, what was that step away and what?
Sorry, another person's video started playing out of nowhere.
Okay, all good.
So yeah, just step away so I can just watch your form as you're doing it.
You want me to face you?
Yeah, face me to start.
Yeah.
Oh yeah, better view now. I can see more.
Sorry, I didn't know that was in the way.
All right. Look straight ahead. So when you slouch, don't slouch through so much, just through the ribs. So you don't have to go, yeah, there you go, just through the ribs. And then you do that, you feel your arch coming up.
Yeah.
Yeah, and then you see your arch going down as you go forward. Good. And when you come forward, make sure you look up. There you go. And then when you come back, you can slouch.
And then weight's going to the outer part of the heel, correct?
Yep. And then when you go forward, just think heavy on your towel there, and you'll find the
Heavy
foot
on towel.
out.
Okay.
Right.
Okay, yeah, I feel quad going a lot more that way.
A few more.
Dude, this lights the glutes up a lot.
Yeah. As it should. Good. And you can take a pause there and remove the towel and do the same thing.
Still heavy on the heel, right?
Yep. So stay heavy on the heel still. Is that okay?
Yeah, just a lot of glute.
Good. And you can relax. There wasn't a lot of glute before?
Not that much. And then I
Yeah.
started feeling medial quad quite a bit too.
That's good. Those are all things that's supposed to happen when the foot
Okay.
So you can be loading into the VMO, you can be loading into the glute and the upper hamstring at the same time.
Yep, definitely felt that.
Let's have you step back to where you are. We can retest some of the motions. Let's get your feet involved too. So bring the camera down a little bit. Right there's good. Good.
Am I good?
Yep, turn yourself facing I think it's your couch. Yeah. Hands on your hips and arch back. Go, 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 go. Good. All right. How's that feel?
Feel like I got more, I guess in terms of like just not feeling 100%, kind of the same, but I feel like I'm going back further.
Okay. Are you stopping yourself from shifting your weight forward?
What do you mean?
Are you
Like it should be going towards like
yeah,
that, you mean?
your weight should be going towards your toes.
Like that?
Yeah, how's that feel?
Uh, more range. It's just that same kind of left-sided.
Yeah. Go. Got it. Good. And come back. And turn and face me. Let's do a side bend to the right. Okay. And how's that feel?
Maybe a little more range.
Okay. Discomfort wise.
Um, Same kind of that left, like low sided, just not feeling 100.
Okay. And come back. And let's do left side bend. Good. And come back. And that's all good there.
Mhm.
Hands in your chest here. And let's go ahead and same thing, left rotation. Okay. How's that feel?
Feel like I'm going more than even after the Mackenzie extensions we did.
Yeah.
The right actually feels even more limited.
Yeah. Got it. Got it. Good. Okay. Now we do the same exact move, the forward weight shift move, pronation drill with the right foot. And you can stay in that angle right there.
So heavy on the heels.
Yeah.
Coming through.
Yeah.
And then
Good.
you said just do the upper back, right?
Yeah, just the rib cage. Make sure when you're doing this, you have a tripod. So big toe joint, little toe joint, and heel, they should always be on the ground. So if you start to lose any part of that, let me know.
I was losing the big toe a little bit as I was coming into this part.
Right. And if it's helpful for you, what you can do is slip a
Uh-huh.
little um thing on your big toe joint just so you don't lose that point. Yeah, and you can make it thick as you like in order for you to feel good contact on it throughout the whole entire movement.
Feeling the quad, but hip not so much on this one.
Okay, let's add a towel to the heel.
In addition to the
Yep. Addition. Heavy on the heel as you go forward.
takes a lot of mental focus.
I say just stay on heavy on the heel as you bring your weight forward and just let your body do what it does. You don't have to think too much about it. Okay, let's do the same thing, but do on the left side, the two towels. On your, when you do it, make sure you have it on the toe joint and not just a big toe. And
Like more, you mean?
yeah, maybe a little like thicker of a towel. Maybe fold that in half. There you go, on the toe joint. Yep.
Good.
Yep, that looks good.
Okay.
Okay, and come out of there. And let's see rotation. Good.
Oh, a lot more.
Yeah, and then right rotation.
Still doesn't feel as much as the left, but I feel like I'm getting more.
Yeah, you're definitely getting more on the left.
Yeah, left, I actually noticed a pretty big difference after that one.
And then the right. Okay, cool. So we see some side bends. Side bend looks good.
Just a stretch through the right side with that one,
Mhm.
and then just a stretch through the left side.
Yeah. How's that? Does it feel smoother or does it still feel like kind of icky?
A little bit, but I think just based off of what you said, where like the small minor ones, not so much. The rotation I felt a lot though.
Okay.
Yeah.
And let's see a back bend. Okay. And what does it feel like for you over here?
Compared to earlier, I actually feel a lot of the weight onto my toes and balls of the feet.
Mm-hmm.
Area wise, it's still kind of in the same left-sided spot.
Mm-hmm. Got it.
Yeah.
Okay. Sweet, sweet. We're getting there. We're getting there. All right.
I could tell I'm going further.
Yeah, I'm gonna show some pictures for now. Actually,
Okay.
before we do that, let's do left foot's balance. Couple little mini bends.
Am I good right here?
Yeah, we're good. Okay. How's that feel?
Feels pretty good. But I think because we've done a lot, I can't exactly remember how the first go
Right, right,
felt.
right.
Um,
Okay, and come back.
yeah.
I took a bunch of pictures and we're just gonna go through a couple of them.
Okay.
Organize them all.
Mhm.
So we'll just look at some of the more restricted movements to start.
Oh, yeah, that's a big difference.
So we know we cleaned up a good amount of rotation,
Hmm.
the left to the right. And the side bend, we can see a little bit more opening on the rib
Hmm.
cage right here. I'm just looking at
Yeah.
the curve. We should be able to see a curve.
Uh-huh.
You're getting more, but I think you're getting more because of your hip moving, not because of your rib cage
Got
moving.
it.
Okay. And when it comes to your back bend, I'll show you the back bend.
Oh, wow. That is a big difference.
These are just time stamped. So 10:04, 10:26. So number one, we need to get more comfortable on the
Mhm.
forefoot. Because
Okay.
if you don't go back into the forefoot, you're just gonna fall backwards, and your muscles are
Mhm.
gonna tense to prevent you from falling. So
Mhm.
neurologically, you're not really gonna get a good amount of back bend. One thing I'm looking at also here is the extensibility of the rib cage. So I would like to see this rib cage go up. So
Mhm.
both not really going up tells me your stomach tissue
Mhm.
is definitely tight. There needs
Okay.
to be more length happening over here. And
Mhm.
length should happen here, not just from front to back, but also I want length to be equal on the left and the right side of the
Mhm.
tissue. So left obliques, right oblique, they all need to lengthen as well. Okay.
Mhm.
And I'm gonna take a look at some single leg here.
That rotation was a big improvement.
The rotation is huge.
That's the one I like me internally, like that's the one I felt the most where I went, I was like, oh shit, this is oh sorry, didn't mean to curse. That's the one where I felt
Okay.
the most.
Yeah, yeah. So let's see. Single leg. And not that organized, so give me a moment.
No, you're good.
I'm just gonna compare the single leg knee bend from the right to the left, and I'll show you what I see. From a biomechanical point of view. So we see a left-right comparison.
Mhm.
I'm just gonna draw a line down, and I'm just gonna draw a line down. So
Mhm.
not too bad, but I would say just where the hip position is,
Mhm.
it's a bit different. I think we're a little more lined up nicely on the right versus I think we're overly internally rotated here. Because we're
Mhm.
putting the hip out a little bit more. So you're gonna be putting a lot more work into the hip than we would like. Okay.
Mhm.
Part of it, I think we're not experiencing true pronation of that foot. So a foot that goes into pronation will go like this.
Mhm.
But a fake pronation, a lot of foot they do that they just tip right over.
Mhm.
That's what we would say is overpronation.
Mhm.
Is it truly overpronation or just like a orientation of the entire foot going this way?
Versus it's playing, right?
Versus splaying. So what we
Mhm.
try to do is get it to splay.
Mhm.
Now, there's a concept of the neurological center. Say, if I show you my arm and I say, David, go find me the middle, you just need to
Mhm.
understand the starting point A and point B in the middle is very easy to predict.
Mhm.
But if this is your perception, but this is reality, then your perception is off and skewed.
Mhm.
And you operate everything around this perception of that middle. So if you can experience a arch foot on your left, but then you never experience a true pronation foot, then you're going to be somewhere, your perception of the middle is going to be off on that left side.
Mhm.
And you're not going to feel very stable because everything is all shifted. And then your whole body have to kind of find its way around to the center. So your hip might poke out a little bit more. And that's when we start seeing some Trendelenburg gait. So you can have really strong hips, you can have really strong adductors, abductors, but it means nothing when you can experience that position in closed chain. And that's why the foot is so important. So I
Mhm.
want to dive a little bit more on your left foot,
Mhm.
see if we can get things to look a little bit smoother. Okay.
Mhm.
So I'm gonna play around with the the towels again. I'm
Mhm.
gonna have you slip a towel on the heel. I'm
Mhm.
gonna have you slip a towel directly on the forefoot as well. So they're both gonna be thickened on both sides.
So one on the heel, you said?
One on the heel and one directly on the forefoot. Exactly.
Okay.
Okay. And all you can do here, you're gonna stay heavy on the heel, slowly drive that knee forward. Okay. Okay, so I think we're overdoing it. So only take the top towel and shift
Uh-huh.
it over to the big toe joint.
Right beneath it, you said?
Yeah, shift it over to the big toe joint. Like
Oh,
toes.
just the big toe.
Yeah, just joint. Yep, just like that. Let's see. Don't like that. Shift it over to the pinky toe joint. That looks a little, that might look a little bit better. I'm not sure how that feel for you.
Just a lot of quad going right now.
Hmm.
Do you want me to consciously put weight into the left pinky?
No, you don't have to because is already there. The
Okay.
proprioception is there.
So just focus on the heel and just keep going.
Yeah.
Okay.
Can I get a side view? So just swivel yourself out to the side. There you go. Do a little less on the heel.
Less on the heel?
Yeah, a little less towel. So shift it back a
Oh,
little.
less like that?
Yeah. Nice, that looks better. Give me a front view now. There you go. That looks better.
Lot more glute with this positioning.
That looks a lot better.
Oh, a lot of glute.
Yeah. Keep that going for a bit. And while you play around with this, I'll just show you the difference. So this was you without anything before. This was 1024. You see, we can't really get a good plumb line. You're all the way shifted. There's too
Uh-huh.
much motion right here. Versus now, you see it's just much cleaner looking lift. See how that knee
Uh-huh.
isn't in nearly as much. You're not going into what we call, it's not true valgus, but it's just too much internal rotation happening right here. I think what's happening is that we were losing a little bit of contact of the pinky toe joint, and I think we might
Uh-huh.
have not enough movement in the calcaneus. So now things are lined up really well
Okay.
here. But you can see the difference, right? This hip is all the way out here versus you're more centered on this one.
Yeah.
Cool. Yeah, looks a lot better. Now, what I want you to do, as you bring your weight forward, I want you to take your right arm and I want you to reach up nice and high. The reaching up with the arm is to elevate the sternum
Uh-huh.
like this. And
So I'm
also,
just coming like this.
yep, yep, it's also gonna give you that. So bring your knee forward first and then do that. Perfect.
So I should feel a stretch on my right side, correct?
You will feel a stretching, like an opening of the rib cage here. Not a crunch on the right, but just like a dropping down, coming closer together, but it shouldn't feel like a pinch. Do you feel it? Is that okay?
Stretch here a little bit on the left low back, but nothing crazy.
Okay. And as you reach up with that right arm, allow that left shoulder to just relax and drop. There you go. Nice. How's that feel?
Feels good.
Good. Do a few more. Good. And you come out of there, remove the towels, and you're just gonna go ahead and try just the pronation drill with the foot. Don't even use, yeah. Slowly stay heavy on the heel as you go forward. Okay. And add the right arm reach. Does that feel okay still?
Yeah, less stretch through the right.
Yeah. Okay. And stop there. And you can go back to middle and check some rotation. Good. And then right rotation. Good. Now, I like this one better because it's more even on both sides.
Okay.
You feel
Yeah,
good?
it feels good.
Yeah.
Mhm.
Left is even. Good. And let's see some side bends. That looks good. And then let's see some side bend. And how's that feel?
Just a stretch, nothing in the low back.
Okay. Does it feel different in your low back?
Yeah, I'm not getting that weird, like, just not 100% feeling.
Okay. Cool. Let's balance your left leg. Give me 3 little bends.
Hey,
All right. Nice. How's that feel?
that one felt okay. I don't know if I noticed anything super major.
This is the toughest one to address.
Yeah.
There's a lot of moving parts for that one. Turn
Mhm.
yourself to the side and give me a back bend. Okay. How's that feel?
Feels good. I think I'm seeing the biggest differences with the rotation. The other ones, it's a little bit harder for me to kind of see if there's anything major.
Gotcha. All right. Let's do a right foot in front. And we'll do the same thing, right foot in front and reaching up with the left arm.
So heavy on the heels,
Yeah,
come forward, and then do this.
exactly.
Okay.
Keep your head looking forward. So you feel an opening on your left side.
Yeah, less stretch compared to the right side.
Mm-hmm. That up. Try reaching a little bit higher. Nice. How's that?
Feels okay.
There you go. And you can do an inhale into your chest as you reach.
More stretch.
Good. Inhale into your chest as you go. Good. And as you reach up with the left, you will notice that there's gonna be a counter rotation to the right.
Yeah,
Like, okay, that's good. Allow that counter rotation to happen. Because running, walking, all it is a pelvis rotating one direction and a torso rotating the opposite direction.
yeah.
It's a foot that pronates and the pelvis that rotates the opposite, torso rotates the opposite, and the head rotates the opposite. It's just a bunch of different crisscrosses.
Just make sure. So rather than focusing on the shoulder dip, just let it kind of rotate this way, is what you're saying?
It would dip and rotate. So allow
Okay.
that. The key is not to force it, but let it happen and keep your head facing forward. There you go. Because what you're working on right now is pretty much the mid stance of gait. Go, go, go. Yeah. Let's turn them up. And get that stretch in your stomach, especially on that left side.
Yeah.
Good. Do one more. Nice work. Good. Nice. Come back to center. Go ahead and give me some side bends. Come forward a little
So,
bit. There you go. Back away a little. Sorry.
good.
Yeah, go ahead. Give me some side bend. Yep, that one looks clean. And
I
then,
feel like I'm going further.
yeah, this one's looking much cleaner. How's that feel?
Yeah, just a stretch through the side, but nothing in the low back like I did earlier.
That's perfect. So we got rid of that low back.
Yeah.
Nice. And then let's do side view, back bend.
Much less in the low back.
Nice.
Oh, so that's that rib cage thing you were talking about.
Yeah. Now it's freely opening. But see how that rib cage has to open with a foot that can pronate as well? They gotta come
Yeah.
together, especially when you're close train. And your back feels better?
Yeah, it's still there, but not as intense as it was.
Sweet. Love it. Take a couple more pictures here. So. Pictures are helpful for you or no?
What was that?
Pictures helpful for you?
Yeah.
Sweet. Line them up so we see a timestamp.
I feel the arch in my left foot.
Yeah, that's perfect. We need that.
Yeah.
See the side bend progressions. So
Oh yeah, I get what you mean with the rib cage.
yeah, so in the beginning, pretty much like a straight line.
Hmm.
Now it's still kind of a straight line. So you're getting a lot more hips. You can right now on the beginning, you didn't want to shift your weight over to the left.
Hmm.
Now we got a little bit more here, and now we got a lot more shifting over to the left.
Yeah.
And a bit more of a uniform side bend right here. So it's
Hmm.
just things are just a lot more open on the left rib here.
Hmm.
It all has to do with your ability to be able to feel comfortable on this left foot.
Hmm.
And that's what that pronation drill is going to do for you. So I do recommend getting some wedges, but in the meantime, I think having that towel combination will be
Hmm.
good for you in the meantime.
Okay.
Okay.
Cool.
So that looks good. Let's do that again with the left. I want to make sure that we can get it down. And this time, I'm just gonna have the towel on the heel and forget about the pinky toe joint for now. I want to see if that was a relevant thing for us or if it's just something that we came across by accident.
Okay.
Okay.
So just heavy on the heel, come through, and then you want the right arm or no?
No, just do the body. And as you come
Okay.
forward and you let your body relax, you might find that your ribs come up anyways and your pelvis roll down anyways.
Yeah, a little bit.
You know? Okay. That looks pretty good. Can you come a little bit closer?
Yeah.
There you go. So it's a smaller step.
Is that okay? Oh, you mean like my back foot?
Yeah, smaller step. And as you come forward this time around, allow your right heel to lift off the ground so you can be on your toes. Yeah, is that okay?
Yeah.
Good. And then raise the right arm.
Okay.
Okay, come back. Add the pinky toe on there. Okay. Looks like the pinky toe was necessary.
Okay.
Let me see
Or
side.
just looking at midline right now?
Yeah, let me see side view. Okay. Okay. Got it. And come out of there. Now, as you shift your weight forward in front, allow pelvis to drop, and I would even encourage the right hip to drop a little bit if you can. So as you come forward on the left, see how we have an anterior tilt?
Yeah.
That's allow that to happen. And if you keep going forward, this anterior tilt, at some point, the right heel will come off, and this hip will actually drop lower than this one, allowing a nice big stretch right here. So this hip would drop a little, but the back heel also to come off.
Yeah.
Yeah, because I want you to go without dropping down. It's just a forward horizontal motion. You might get a hip flexor stretch on the right.
Yeah.
Nice. Good. Nice work. Yeah. Keep going. How's that feel?
A lot of quad,
Yeah. Inner quad, where is it?
inner.
Oh, perfect. Good. Now remove the towels and see if you can still feel similar. Yeah, stay heavy on your heel. Yeah.
Yeah. Still a lot of quad.
Good. Nice. Switch to right foot.
You want me to reach?
Yeah. Nice. And now the left hip is going to drop a little bit as you go forward. There you go. You should feel a nice hip flexor stretch happening on that left side.
Yep.
Good. And we'll add a little bit more here, which is when you go forward, bring a little bit of
Uh-huh.
tension to the pinky toe joint on the left,
On the left.
on the back leg as you go forward. So what that does, it will externally rotate your entire left leg, giving you a more exaggerated.
Deeper hip flexor.
Exactly.
Okay.
Because the hip flexor is a 3D muscle. It will get
Oh
lengthened.
yeah, I feel it.
It get lengthened into extension, external rotation, and in the frontal plane with the hip dropping. So you can experience all three of that length. And the left back foot was supinate,
Yeah.
while the right front foot pronates.
Yeah. A lot of hip flexor.
Yeah, good. And then come out. Good, good, good. You okay?
Yeah. We're gonna feel a difference on this one. I can feel it already.
Let's move the camera up a little bit and see. All right, cool. Let's do rotation. Yep. And let's do rotation. Yeah, pretty much even. How's that feel?
Feels good.
Let's do side bend. Nice. Do side bend. Shit.
I feel like I'm going a lot further on this one.
Yeah, how's that? How's that feel?
Yeah. Feels good. Just a stretch, but nothing in that low back.
Yeah. Looks great.
Yeah, I feel this opening up a lot.
So much more. Okay, turn yourself to the side. Hands on your hips, arch back. Yes.
Yeah, that one's good.
What do you mean by good?
So I'm still getting like a little bit of the compression, but like that left weird feeling, I'm not really getting that.
That's sweet. All right. Now let's balance on your left foot and give me 3 little bends. Yeah, there you go. Good. How's that feel?
Hard to compare, but feels like I'm not doing this as much.
Cool. Yeah, all of that definitely a huge improvement, and we'll do one last little screenshot.
Okay.
Start with side bends.
Oh
Okay.
yeah.
Yeah.
It's more of that curve like you were talking about.
Very curved. This is side bend to the left, opening up the right.
Mm-hmm.
This is probably the best part. Way different.
Oh yeah. That was very restricted when we first started.
You shifting your hip a lot more to this
Mhm.
side. And we didn't have to tell you to do so. It just sort of happening. You get a lot more extensibility right here.
Mhm.
Side bends are really clean. Let's take a look at rotation.
It's a lot of small stuff that makes a big difference. Because I saw the webinar that you did, and a lot of like the pinky toe and all that stuff, but I didn't get the same feeling as when you were guiding me through it just now.
Oh yeah, the nuances make a difference. So
Yeah.
was right rotation.
Oh yeah, a lot more.
Yeah, even though right rotation wasn't really an issue. There's a 1005
Hmm.
right now. So right rotation is still better. What I like to see is just the hips rotating, not the
Hmm.
ground rotating. And
Not a
being
what?
the hips are rotating better.
Okay, yeah.
Yeah, because your feet can move a feel more safe moving. And then of course the left rotation is stupid.
Yeah. That was money.
Yeah, there really isn't any kind of hip rotation or anything like that. But now everything's moving a lot smoother going towards that left side.
Hmm.
Lastly, I think we have back extension. Let's take a look.
Oh yeah.
Back extension definitely smoother.
Hmm.
Good. Still restricted in your stomach. I would probably foam roll your stomach and do a couple more of those stomach stretches on both
Okay,
sides, and that will clean up the way you can reach with that exercise as well.
got it.
Yeah. Cool, man. So, just to summarize, I'm gonna write my notes here. It's gonna be need to address left foot pronation with pinky toe wedge and heel wedge. Right foot pronation with reach arm reach. You can experience stomach stretch. All right. So these are the kind of the low hanging fruits that you can start off with.
Hmm.
The way you just did these moves like that.
Hmm.
If I take this arm down, I'm in my mid stance of gait. I'm a running stride, and I just need everything to line up and working well on the left
Hmm.
side and on the right side. But if we can't feel our foot in those two shapes, then we might have one side that looks a little bit more like this. That's like kind of what your left side was doing. It's just too far going in.
Yeah.
Think about if we miss our pinky toe joint, what's stopping us from doing this?
Hmm.
So we have a little bit of contact on the pinky toe joint. Now it brings us back closer to where we need to be.
Hmm.
So that's how the foot mechanics work. And over
Cool.
time, these are the training wheels. So you're not going to use them forever, but in the beginning, it's very good to get that neurological feedback.
Yeah.
Once you have it, you take them away and you just still be able to feel it. So it's sort of like GPS tells you the highway's back. Great. Take it a couple more times, and then you don't need the GPS at all. You're just gonna know
Hmm.
it's gonna be that highway that you can take every single time.
Yeah.
And that's what we're doing for the foot.
Okay.
Cool. All right, man. You got some questions?
No, that was good. That was cool to see. Because like I was saying, like, because I've been following, like, I downloaded your app, I was following all that stuff, and then like seeing the movements via that is different, but like having you like correct it live, where it's like, hey, put this under your foot or put this under your pinky toe or whatnot, makes a big difference on like what you feel. Um, Dude, you got to make a Con Ed course for this stuff, man. I take it.
Yeah. I tried it one. There was a clinic that hired me to do in service. We did it for 3 hours, and we talked
Uh-huh.
about and this whole thing. I just don't know how valuable it is because I'm not sure if they were able to take that and use it the next day.
Oh,
You know what I mean?
yeah, yeah, yeah. I can see how like if I were to take someone through your this, like I probably wouldn't be able to make like the minor nuance changes. But
Yeah.
no, it was cool to see. Thanks for taking the time. That was really cool.
It's an anatomy and motion, so feel free to take Gary Ward's stuff. Like all his stuff is fantastic. And when you
Mhm.
boil it down to the very core principle of what it is, it's not magic. It's biomechanics.
Mhm.
It's all it is. When this
Yeah.
bone does this, gravity puts this bone in this position, this bone in this position. And when they can't experience these shapes, what's the cascading event that happens upstream? And you just
Mhm.
trace it all the way up. And you can trace it back to like neck rotations all the way from the foot. And once you can have that, you can really figure out a lot of things by these by these variables and frameworks.
You said it was anatomy in motion.
Anatomy in motion is a guy named
Is it
Gary.
a Australian thing?
Yeah, yeah,
What?
UK. Gary Ward is the name.
Gary.
Yeah,
Cool.
it's something I've been studying for the last 5, 6 years now, and
Okay, cool.
it is like you just keep reviewing it.
Okay, I'll definitely take a look.
Yeah,
So in terms of homework for me with the left foot, wedge on the heel, pinky side, and on the right side, as I'm going into the stretch, just make sure that my left pinky toe is getting pressure.
yeah.
Okay.
But what I'll do,
Uh-huh.
this one will be online, so you can view this one at any time. But
Uh-huh.
I'll also send you a couple of videos of me showing you these exercises, and you can,
Oh, yes, please.
yeah, you keep that in your repertoire.
Cool, cool, cool. Yeah, that'll be helpful.
Keep that for spin. And if you would like to book like a follow-up or something like that, give these a try, let me know, and we
Yeah.
also do it again because it's always fun for me to treat another clinician because it's easy.
Yeah, yeah, yeah. That was cool. Yeah, yeah. I'm gonna try these out, and then if I feel like I need more